Hello everyone. In today's video, we are going to talk about imaging the male breast. So let me know in the comment box if you all knew that males could get cancer if you have seen a male in your clinic taking like a mammogram picture for like a diagnosis. So just comment below and let me know. I want to give a special shout out to these ladies who passed their registry in this month, which is July 2025. They watched my mammo videos. I think they went through the playlist and just kept watching the videos. If they watched the video and they needed more videos or wanted more videos, they always left a comment. So shout out to them and check out my playlist. I will try to attach it to the end of the video and I also leave it in the description box. All right, so now we have the male breast. The male breast cancer is very rare and it does make up about 1% of all breast cancers. The male breast tissue is less fatty. So whenever you do try to position them, such as like with women, it's less tissue that you are able to grab. I do find it easier whenever males have like smaller breast tissue or chest tissue. I find it easier to use the small paddle. And I've had a handful of male patients where I had to image. And for most of them, I used either the large paddle or the small paddle. But I think for maybe one or two, I had to use the very small paddle. And I know whenever they have like hair on their chest, whenever they have a lot of hair, it does make it harder to position them because their breast or chest tissue tend to like slip away from the detector, and you just have to like keep readjusting them. I've had a tech who have told me that sometimes she will like put like a little water on their chest to make their chest like stick on the or stay on the detector. I haven't tried that because I haven't had any more problems with like keeping their breasts on the detector. But if it is hairy, it does make it difficult to position them. For your tube angle, before I forget, for the tube angle, I just had it angled to 45 degrees, and then if they were like very slender or kyphotic, I would angle the tube to 50 to 55 degrees. That's how you would take the images. You'll just image them the same way as for female patients. Also, before I forget, do not, please do not give male patients a robe. I had got caught up in the moment of just because for most facilities, you're going to image women. It's going to be like women coming in, and I made the like mistake and gave a male patient a robe because when they come in, they're going to not have as much information to fill out as far as like when you're documenting on them, you're not gonna have to ask them about menstruation. You're not going to have to ask them about pregnancy. So that eliminates a lot of questions because you don't have to ask them about hysterectomy, what age they had the first child, what age they had their last child. So I gave whenever they come in, they just come in to the mammal room after they have filled out their paperwork. They don't have to stay in the dressing room because they just come in and they take off their shirt. So I was just trying to be respectful one day, and I gave a male patient a robe, and he was like, "What I'm going to do with this?" So don't give them a robe unless they ask for one. Most of them, they just want to take their shirt off and just let you take the images like that. Males do have hormones that prevent the growth of lobules. This will keep the ducts from growing to a certain minimum. You have male breast enlargements, which comes from the growth of the ducts and their supporting tissues. This is known as gynecomastia. A lot of times when males would come in and they will have like they will feel something or have pain around or behind their nipple. Majority of the time, it will be diagnosed as gynecomastia. Younger boys can experience a growth in their breast tissue due to hormones being secreted by their testes. For gynecomastia in men, this is caused by certain drugs, diseases, or hormones such as estrogen for older men. Estrogen can be used to treat cancer. Certain prescribed drugs can trigger gynecomastia. This is cardiovascular disorders, high blood pressure, seizures, migraines. So whenever you get a male patient, just take down the list of medications that they are on. And like I was saying, this is very important, extremely important. Always write and chart the medication that the patient is taking. This is pretty much for male patients. You do not necessarily have to do this for female patients unless you have a female patient who is like on testosterone medicine or, of course, estrogen and progesterone. But as far as blood pressure medicine, you do not have to take this down for female patients. This can help the radiologist determine what pathology or condition the patient has, since certain medication can affect or have a different pathology results, especially if the patient's coming in with certain signs and symptoms. Like for an example, if a female patient come in and they have like certain changes going on with their breast tissue, um, it's very important to let the radiologist know they have been taking testosterone medicine for, let's say, 6 months or a year or even 7 years, because this can really determine these changes is from this medication versus this change is from like a known condition. So it's good whenever, especially for male patients, whenever you can like get a full history of the medication that they're on, because it could be causing them to develop like gynecomastia. The diseases that causes gynecomastia, you have your cirrhosis of the liver, cancer of the testes, Klinefelter syndrome, which is a rare disease. It has an abnormal chromosome pattern, which is your XXY, chronic renal dialysis, cancer of the adrenal glands, oversecretion of estrogen that is caused by the endocrine disorders. So if you do not mind, could you please leave a comment under the video to let me know if you have taken a mammogram image on a male patient or have you seen one done before? Um, the first time that I have known that male patients or males can get breast cancer, it was whenever I was working at an urgent care as an x-ray tech, and a guy came in and I was just jotting down his history, and he told me that he has a history of breast cancer. And that was probably like my second or third year of being an x-ray tech before I even got into radiology. I've never heard of that before. um, so yeah, just let me know in the comment box when I first had my male patient or knew a male had came into the clinic. To be honest with you, I was like extremely nervous because I was like, okay, what am I going to do differently, like position wise for them that I would do for women? What if their breast or chest tissue is like so small that I can't get any images? And then so that was just making me like extremely nervous, but it is not hard at all. Whenever you get your first male patient, just shadow a tech and just let them know, hey, I've never done this before. Can I watch you? Because they're very easy to image, especially if they have like large breast tissue. Their image is going to look very similar to women breast tissue. It looks pretty much the same whenever you are imaging them. You can get like a good IMF on male patients, a lot of muscle. So the only challenge that I face with them, male patients, is like if their breast tissue is extremely small or if they have like a lot of hair on their chest. But if they do have like a lot of hair on their chest, you can see if they would like to shave before they come in, or most places have like a razor or like a clipper. That's what I'm trying to say. Have a clipper for you can shave them as well. So the breast cancer for males, they do have risk factors as well, just like women. Their risk factors is use of hormones. Gynecomastia has developed from taking estrogen to treat prostate cancer. Age, the same as women, the older that they are, the likely their chance of probably getting it in the future whenever they are older. Klinefelter syndrome, heredity, their chances of getting it increases if their father or brother has had it. I've even had some male patients who came in and they was like their mom was diagnosed with it. The breast cancer gene, also radiation exposure. You also have more signs and symptoms for males. This would be very similar to how the women have their signs and symptoms for breast cancers. Lumps and pain is easily felt with male patients because their breast tissue is a lot smaller. Most cancers occur around the areola. A lot of times, if they're coming in with pain or a lump, it is around that nipple area. Diagnoses are delayed for males since they do not perform routine breast exams. If you are a male and you're watching this video just for educational purposes, could you let me know in the comment box if you perform breast self examinations on yourself where you lift up your arm and you feel like your breast tissue in a circle? That's how women do it. So if you are a male, just let me know in the comment box. All right, so if you are finding this video helpful, could you please give it a like, share, and subscribe for more videos? Now we have our diagnosis and treatments for males. Of course, whenever they do feel a lump or have a pain, especially on one side that is just extremely bothering them, is keeping them up at night, they're worried about it, the first thing they're going to do is reach out to their doctor. They're going to go into the clinic. The doctor is going to do like a physical exam, see if they can feel what they're feeling, or even if it's pain and because the doctor can't feel pain. So if the patient is saying they have pain, then they will order the diagnostic mammogram and or breast ultrasound. So even if male patients come in and they are feeling like a lump or pain in one breast, they still have to get both breast image. Well, at least this is for my clinic. If it's different for yours, could you just let me know in the comment box? Also, they will have the breast ultrasound if the radiologists feel like it is necessary. Sometimes when they're diagnosed with certain conditions or if they have pain and the mammogram isn't showing anything, then the breast ultrasound they won't have to get. But it all depends on their diagnosis, their symptoms, and what the radiologist, recommends. And you do have a radical mastectomy is the primary treatment for breast cancer in men. So just keep that in mind. Radiation therapy is sometimes used to treat breast cancer in men. That is at stage 1. If they do want to take chemotherapy, that's up to the patient and their doctor and based off of like how severe the cancer is, where it's at. So that will all determine if they would do chemotherapy or not. When the cancer spreads in male patients, also called metastasis, when I work in MRI too, other radiology modalities, so you may hear the word METs. Whenever someone is referring to cancer spreading, they may say the patient's coming in to check for METs. The breast cancer can spread just like for women. Most common areas, your lymph nodes, bone, lungs, brain, and liver. So the best solution for male patients is awareness. A lot of times, maybe they do not have self-awareness to feel their breast tissue, or maybe they do not know that's what they should do to check for these lumps. Maybe some male patients, not saying all, but maybe they do not get routine checkups where they are going in and finding out that they should be checking for their on their breast for any signs and symptoms. Maybe they don't know that it's necessary. Maybe they don't know that they can get breast cancer as well. So it's just that some men may lack awareness, and they do have similar breast signs and symptoms just like women. So the common signs and symptoms that men should watch out for is breast lumps, skin dimpling, and nipple retraction. All right, so if you do not mind, could you all just leave a comment? Just let me know what state or country you're watching from. I think this is very helpful for technologists who may want to relocate somewhere, or maybe someone is just coming across this video. They're in X-ray as an X-ray student, or they're thinking about joining radiology. This would give them kind of like an example of, hey, there are a lot of jobs in, sorry, my voice is going out. There are a lot of jobs in mammo, so maybe I want to get into mammo. I think my voice is going out because I did record like another presentation right before this video. So I've been talking for about 45 minutes now. So sorry about that. So if you don't mind, just leave a comment. You can just say I'm watching from, like all of the other ladies did. I have people watching from Houston, Georgia, California, Kentucky, Maryland, Arizona. Um, I think I said Florida. So I have people watching from all over the place. I have not received a comment yet of someone watching in another country. So I'm just curious to know if you're all watching in another country. So if you do not mind, could you just please leave a comment for me? All right, so that's it for the video. Thank you all for watching. Please give the video a thumbs up or leave a comment. Also hit the subscribe button. These are all of the ladies who have passed their registry in 2005. So whenever you do pass your registry, could you come back to one of my videos? Just leave a comment, say, hey, I passed. This just I think it motivates other people to really take my playlist serious and just go through it and watch it, because it lets other people who studying for their registry to know, hey, this is what I did. I watched her playlist, or this video helped me, or that video helped me. You can also let them know I watch her playlist videos for 30 minutes out of the day, an hour. I know one person told me, I don't know if it's on this board or not, but they just said, hey, I watched her videos often. I listened to them while I was in my car. I got some comments like that. So good luck on your registry. Let me know if you're like a new student, if you're already have taken your course and you're just using this just a review. So I look forward to reading your comments. So that's it for this video. Thank you all for watching, and bye.